My name is Caitlin, and I'm going to be doing my medication administration checkoff. And here is my ID. And my videographer, which is my friend, is going to do the name scan. She's also going to include herself. So I'm going to be, first, I'm going to note my no interruption zone policy, which means I won't be taking any phone calls. I will limit my distractions and keep the medication room door closed. And I will only talk to colleagues or pertain to something if it's an absolute emergency. So now I'm going to compare my order form to my MAR, in which I need heparin because that's what I'm administering. So I'm going to be doing comparing. So Jaguar J. Jones, date of birth 08/25/1963, 08/25/1963. Medical record number 417-6352, 417-6352. He has an allergy to penicillin. I will be administering heparin, 5,000 units, subcutaneously, every 12 hours. I would note that the indication is it's an anticoagulant medication, and I would document anything needed to be documented up until this point. So now that I have compared the both, I will put my order form to the side. I will perform hand hygiene, and with my MAR, I'm going to be moving to the medication administration room. So now I'm going to start my first check of rights. So I am going to note that the patient's name is Jaguar J. Jones. I'm going to be administering heparin, in which I have heparin. And I'm going to be giving 5,000 units, so this is 10,000 units per 1 milliliter, which means I will be giving 0.5 milliliters. And I'm also going to note the expiration date is 12/5/25. And I'm going to be giving it subcutaneously, which means I'm going to be using a TB syringe and needle, which is this one. So, and then I'm going to be giving it every 12 hours, in which it has been 12 hours. And I'm going to note that the indication is that it's an anticoagulant medication, and I will document anything needed to be documented up until this point. So now I'm going to prepare my syringe. So the first thing I'm going to do is clean my vial. I'm going to clean from the innermost part to the outer. Throw that away. Then I'm going to get my TB syringe out. Take the cap off. I'm going to pull back 0.5 milliliters of air because that's how much medication I need. And there's my 0.5. So now I'm going to administer the air, and now I'm going to pull back on the medication, getting 0.5. I'm going to get a little bit more than 0.5 in case I have any bubbles, and I'm going to knock any bubbles that I may even have out. And then once I know all my bubbles are out, I'm going to push it back up to 0.5. And then once I have 0.5, I'm going to take my needle out, and then I'm going to recap. And I have 0.5 milliliters. And I'm also, once I draw out the medication, I'm going to get the nurse to double check me just to make sure I do have my 7 rights correctly done. So now that I have this drawn up, I am going to do my second check of rights. So I'm going to note that the name is Jaguar J. Jones. I'm going to be administering heparin, in which I have heparin. And I'm comparing all this with my MAR. I'm going to be giving 5,000 units, in which it's 10,000 units per milliliter. And I have 0.5 milliliters. And I'm going to be giving it subcutaneously, which is a TB syringe and needle. I'm going to be giving it every 12 hours, which it has been 12 hours. I would note that the indication is it's an anticoagulation medication, and I would document anything needed to be documented at this point. So now that I have done my second check of rights, I'm going to prepare my label. And on the label, I'm going to have the name of the patient, the name of the drug, the dosage, the route, and the time. So his name is Jaguar J. Jones. I am giving heparin 5,000 units. Subcutaneously. And every 12 hours. Okay. So now that my label is prepared, I'm going to put it towards the bottom of my syringe where it doesn't cover how much is in my syringe, where I can keep a good amount, or to make sure I have the correct amount in my syringe. So now that I have done my second check of rights and my label, I'm going to move to the patient's room with my MAR, my vial of heparin, and my syringe and label. So now that I'm in here, I'm going to perform hand hygiene, and I am going to explain the procedure to the patient, making sure there are no questions. I'm going to raise the bed to a comfortable working height. I'm going to lower any side rolls needed to be lowered for me to administer this injection. And then I'm going to start my third check of rights. So I'm going to be using my MAR with my vial that I brought in the room, the band, patient armband, and the syringe label. So the first thing I'm going to do is start my third check of rights. So I'm going to note the patient name, Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones. And I'm also going to use two patient identifiers. So I'm going to do the date of birth, 08/25/1963, 08/25/1963, medical record number 417-6352, 417-6352. I'm going to note he has an allergy to penicillin, and at this time I will also ask to see if there are any other allergies, just in case they could have not been noted. And now I would also do any pre-assessment things I need to do before administering the medicine, whether that be checking blood pressure, heart rate, respiratory rate, doing the pain scale. And now I'm going to finish my third check of rights. So I did the right patient, so now I'm going to do heparin, in which I have heparin. And the dose is 5,000 units, in which this is 10,000 units per milliliter, which means I need 0.5 milliliters, which is what I have, 0.5 milliliters. And I'm going to be giving it subcutaneously, which is a TB syringe and needle. And I'm giving it every 12 hours, in which it has been 12 hours. And I would note that the indication is that it is an anticoagulant medication, and I would document anything needed to be documented up until this point. So now that I have done my third check of rights, I'm going to don my gloves and goggles. While doing this, I'm going to note that I'm going to be giving this subcutaneous injection in the abdomen, not going any higher than the costal margins, any lower than the pubic area. I'm not going to go past each side, past the anterior superior iliac spine, and I'm going to say 2 inches around the umbilical area. And also I'm going to pinch 1 inch of the skin, give it at a 45-degree angle, or if I could pinch 2 inches of the skin, I could give it at a 90-degree angle. And due to the medication in the form, I'm not going to be aspirating for blood. So now that I have my gloves and my goggles on, I'm going to clean the injection site with an alcohol correct pad from the innermost area to the outermost area. And I'm going to leave the alcohol pad pointed to just about where I need to inject. So now that I have it cleaned and I have explained where I'm going to be giving it and why and what exactly I'm going to be doing, I'm going to take my cap off and I'm going to pinch 1 inch of skin, and I'm going to be inserting it at a 45-degree angle, and I'm going to insert the medication slowly. Okay, and then once I administer the medication, I'm going to get my alcohol prep pad and apply minimal to no pressure, and I'm not going to massage the site. And once I do that, I will throw that away and then activate the safety device on my needle, putting it in the sharps container. And then once I do that, I'm going to position the patient to comfort by lowering the bed, raising or lowering any side rails, and assessing the patient for any allergic reactions. So now that I have done that, I'm going to take my gloves off and take my goggles off, perform hand hygiene, and now I'm going to go document how I prepared this medicine, how I administered it, and how the patient tolerated this medication. And then after a few minutes or a few hours go by, depending on the policy, I will go back in and reassess the patient just to make sure they're okay and that they tolerated it well. And that is my medication administration checkoff. Thank you.